there, I'm Dr. B.
Hi, Doc.
This is my scribe K. He's helping me out today. Tell me what brought you in to see us.
Well, first off, let me tell you, I've had migraines my entire life. I normally take some Imitrex and follow up with neurology when they get really bad. But this one's something different. I was at work earlier today, and it was just the worst headache of my life. It was on either side of my head, and I felt really nauseous. I went to the bathroom, I threw up, looked in the mirror, couldn't see straight, really blurry. I just felt dizzy, so they sent me home. When I got home and sat down and was trying to relax, my neck got really stiff. It was really painful to move it. Tried some more Imitrex and some Motrin, but it doesn't really seem to help.
Okay. What time did this start?
Probably around 8 hours ago.
Okay, and what were you doing when it started?
Just my normal work at the desk, just typing away on a computer.
And has it been constant, or does it come and go?
It's constant.
Constant. And would you describe it as progressive or sudden onset? Or
It was very sudden.
Very sudden onset, okay. And do you have any symptoms that radiate anywhere, the pain or anything?
Not really. It just kind of localized on either side of my head.
Okay. And how would you describe it on a scale of 1 to 10, with 10 being the worst pain you can imagine?
An 8 or a 9.
Okay. And can you kind of describe the characteristics of it?
It's kind of throbbing, kind of going along with the pulse. The light makes it much, much worse.
Okay. And you said you do have some nausea and vomiting.
Correct.
Have you had any other associated symptoms, like a fever or chills, sweats?
No, not so far.
Have you had a rash?
No.
Okay. Have you been around anybody else who's been sick with similar symptoms?
No.
Okay. And I'm just going to kind of go through some other questions as well. Just let me know if you've had any of these things. Any vision changes?
Yes.
Tell me about that.
It became really blurry. I was looking in the mirror and I couldn't see straight.
Okay. But not like your vision lost, just more blurry?
Correct.
Okay. Any congestion, like nasal congestion or sore throat?
Nope.
Okay. You said you had neck stiffness. Any cough or congestion?
No.
Okay. Any weakness anywhere, like one arm, one leg, or difficulty speaking?
Not that I've noticed.
Okay. And you said nausea. Do you have any belly pain or diarrhea?
No.
Okay. And any other symptoms that I didn't ask about?
Not that I can think of.
Okay. Let's do a physical exam here. I know the light's kind of bothering you, so you just have to bear with me here.
Okay.
If you can just pick one spot and stare at it, and I'm going to look in your eye. Sorry, I know. Just try to keep your eyes open. I'll just help you here. Okay. And just keep staring at the wall. Okay. I am concerned that you might have some papilledema, which is a little bit of fuzziness around the optic fundus. So we'll have to get a CAT scan for that. Watch my finger. It does look like he has a little bit of beats of nystagmus bilaterally. Just look straight ahead again. Look up a little bit more. Thanks. Okay, his pupils are equal and reactive. Can you just look at me for a second? Okay, looking at my nose and using your side vision, can you cover one eye? Okay, tell me when you can see my vision and how many, or my finger and how many fingers I'm holding up.
1.
Okay.
2.
Okay.
1.
Okay.
2.
Okay, good. Let's do the same thing with the other eye. Looking at me, just using your side vision.
1.
Good.
2.
Okay.
1. 2.
Okay. So his visual fields are full. We'll have to get a vision test on you. We'll have the nurse get that, like with the reading chart, just because you're having some blurry vision. But overall, it seems like you're able to see in all fields, which is good. All right, I would like to have you make some faces with me. Raise your eyebrows up, puff your cheeks out. Stick your tongue out. Give me a big smile. Okay. Can you feel me touch here?
Mm-hmm.
Does it feel the same on both sides?
Mm-hmm.
Okay, good. How about here?
Yep.
Same on both sides? How about here? Same on both sides?
Yep.
Okay, good. Hold your arms up. Turn your palms this way. And close your eyes and keep your arms up. Okay, open your eyes. And then shrug your shoulders. Okay. So his cranial nerves 2 through 12 are grossly intact. His sensation is intact. He does not have any pronate or drift. Touch your nose and then touch my finger. Okay, and can you do it with that? Good. Normal finger, nose. Can you take one leg and act like you're scratching your other leg? And do the same with the other. Okay, good. Normal heel, shin. I'm going to lay this bed flat, okay?
Oh, that hurts my neck.
So he has that positive kerning. Negative Brzezinski. All right. Just relax your arm. Just let me hold it. Sometimes it's easier said than done. Just relax, relax, relax. Let me hold your arm. Okay, good. So +2 brachioradialis. Can you turn around this way and hang your feet over the side of the bed there? Kind of let them dangle. Scoot forward just a little bit more. There you go. And then take your hands and pull them together like that, and then pull them apart. Good. Okay, good. +2 bilateral patellar reflexes. You can go ahead and make yourself comfortable. Well, here's the thing. I'm concerned that you could have something going on with the papilledema, so I think we need to do a CAT scan of your brain. Okay, so we'll start with a CAT scan of your brain, just to make sure you don't have anything internally that's obviously bleeding or a mass or anything like that. We'll get some basic labs, so I'll get a CBC, a BMP. I think we should get some medications to try to treat your symptoms, so we can maybe try some Benadryl and Compazine, and I like to wait and see as far as what other pain medications we might give, possibly some Decadron or Depicon for migraine use, but I want to get the CAT scan first, and I don't want to give you any blood thinners. We may end up needing to do a lumbar puncture to look for blood. Sometimes what you have could cause a bleed in the brain, and so what we would do is do a lumbar puncture, so we would need to get CSF, get the CSF panel for and order a lumbar puncture to the bedside. So what that involves is, anesthetizing the area, getting and taking some spinal fluid out, and then sending it to the lab for testing to see if there's any blood, if there would need to be some sort of intervention. I know that's a lot. Do you have any questions?
Do you think I can get something for nausea?
Yes, we can give you some Zofran. Zofran, 4 milligrams IV, or IV ×1 now. All right.
Thank you.
Thank you. Okay, can we get a CBC, a BMP, PT, INR, a CT of the head without contrast, and a CTA of the head and neck with contrast? We'll also get an EKG, have the nursing order put in for an LP kit to the bedside, and then go ahead and get the CSF panel. Let's give him something for his symptoms. Let's give him some Compazine, 10 milligrams IV, and some Benadryl, 50 milligrams IV. Thank you.